I'm Dr. William Morgan, and I work at Chambers Medical Group. I'm here today to talk to you about how we treat injuries that may develop in a motor vehicle accident. The very common injury, particularly with automobile accidents, is injuries to the shoulder itself. The shoulder, believe it or not, is more than one joint, however. There are 3 joints in the shoulder. So I'm going to go over an examination of what we would perform on a patient that came in with shoulder pain following a motor vehicle accident, and then talk a little bit about how we may treat some of these modalities, period. Because the shoulder, as I mentioned, is 3 joints. Part of it comes from the collarbone itself. As it comes over into the shoulder joint, there's a little bit of a bump there. It's called the acromioclavicular joint. And then there is an articulation or a small joint that helps with stability of the shoulder itself. And then we come to the front of the joint again to look now at the soft tissues. Everybody's heard of a rotator cuff tear. There's 4 muscles within the shoulder joint that causes the following motions: internal rotation of the shoulder, external rotation, but more important, the ability to bring the shoulder up to the side. This patient has a mechanical block, but the rotator cuff is then examined by palpating the insertion, and that would be tender in people with a bad rotator cuff in this area. Also, people with rotator cuff tears will have weakness of their ability to bring their shoulder out as well. So once we get the examination done and we suspect these lesions, then we would follow up with an MRI and make decisions based upon those findings.